We welcome you all to Talk the Talk. My name is Janine Stiene.
And I'm Toni-Ann Antoniato,
the Masters of Myofunctional Therapy.
Together we interview physicians, dentists, and other professionals to learn how their expertise can benefit you, your child, or your patient's speech and language skills and complement the services they are receiving. On this episode of Talk the Talk, we welcome two registered dental hygienists and myofunctional therapists, Sarah Hornsby and Melissa Mugno. Sarah and Melissa are the founders of Technology and members of the myofunctional department at the Breathe Institute. Both Sarah and Melissa are leaders in the field of myofunctional therapy, and they also participate in the Myo Mentor program. They both spend their time lecturing and teaching other professionals and providers about myofunctional therapy. We are very excited to have Sarah and Melissa with us today as fellow myofunctional therapists and fellow professionals who share in our passion for myofunctional therapy. Thank you both for joining us.
Yes, thank you.
Thanks for having us.
Okay, so just to go into a little bit, Sarah, I know that you have shared a personal experience that has brought you into this field of myofunctional therapy. Can you share a little bit with us and the listeners about your own personal experience in this field?
Yeah, actually, it's funny because when Melissa and I lecture together recently, we've both been talking about our own myofunctional symptoms and how that's really led us down this journey to treat patients, and how even as our careers kind of, continue over, I mean, both of us have been in the field for 10, 11, 12 years at this point. I don't know, but it's almost like the more we get into it, the more we have the opportunity to fix ourselves and, understand our symptoms. And so it's almost just been like a career-long journey. But yes, in my first myofunctional therapy class, the first training course I ever took, I was sitting there in the classroom realizing that my tongue was in the bottom of my mouth, not in the top of my mouth. And it just made me start to question everything in my training, in, the doctors I had worked for. And I thought, if I have these things and I didn't even know, and I'm a professional and I didn't even know this was a thing, it's a field. I didn't even know that your tongue mattered. And I thought, if I didn't know that, then how can my patients know this? Like, I'm a professional, I went to a good school. And so it caused me to really, I think, start questioning everything. I think Melissa has a similar experience. So
yeah, absolutely. Actually, one of our beginning slogans of Faceology is like, I've been in your shoes.
And not in your mouth.
I've been in your shoes. I've definitely dealt with everything in your mouth, not only as a provider, but like as a patient and a parent. And when I say those words, I mean it 100%. So I have two children that both have had myofunctional disorders and tongue tie releases and the whole gamut. But actually, a couple of years ago, I did a lecture for Light Scalpel that some have said has been one of my better ones. And it was me opening up with a picture of myself mouth breathing at the age of, I think, 3.5. And I was told to drop out of high school at one point because they said that I wasn't smart enough to get through it.
Wow.
Wow.
I have severe UARS, and I suffered really hard being able to wake up in the morning. And I really struggled having memorization in the morning. And I really had defined myself as somebody who was not intelligent or was lazy. And it really defined a big part of my self-worth and characteristics of myself for a long time. Dental, in a lot of ways, saved my life. And I mean that as cliche and funny as that sounds. I started off as a dental assistant. And what was so good for me is when I got to see the mouth, I started off with an endodontist. And I'll never forget the first time I saw a tooth from the apex to the crown. And I was like, whoa, like I could see everything and it made sense. And I realized what a visual learner I was. And then that really opened up my whole life. And I've been in dental ever since. And then I remember sitting at my first class at a myo race course. And I'm like, wait a minute, that's me.
And terrible when you have that realization, isn't it?
And I'll tell you, since that moment, Myo has always been such a way for me to communicate to patients. I almost call it now my superpower, because my area of strength is definitely the consult. I've always been able to, I can connect really well and communicate on a really good way because I can relate so much to patients. Mm-hmm. And I can look in someone's mouth and feel their pain, if that makes sense, as silly as that sounds. Mm-hmm. And I really do believe, as oral health professionals, we have such a gift and an opportunity, because we get to know and be really intimate with the window of the body, and the mouth shows us everything that's going on if you're willing and able to educate yourself to know what to look for. And that's, where it's so personal for me. And I feel so lucky that I get to do this work, and never mind get to do it with one of my best friends,
That is absolutely. And I feel like it was so disheartening, especially during the early stages of pandemic, that dentistry was not considered this, emergency medicine, or the medicine that, continued to be practiced for a period of time. Because I do feel like, similar to you, that yes, there is so much that we learn about a patient just from looking in their mouth. And when people were avoiding the doctors at all costs, and just a fear of COVID, to take them completely out of the dental perspective or the dental arena for this extended period of time, I think there was just a lot of missed opportunity for early identification and then early intervention at that point. And we're definitely seeing people trying to do the catch up now. But like anything else, they've grown, they've gotten bigger, stronger, faster. And we have to continue to make those modifications in order to make up for time that was missed. How would you...
Sorry, on one side, I would almost kind of say to you, I agree with you 100%, but on another area where I try to find the good in all, right? And so a positive of where I realized the pandemic, where it was so tough on everyone, I feel like people are more aware now. You can say to them, so do you remember when you wore that mask, how that made you feel, that anxiety it created? Did you notice how anxious you got or how claustrophobic you felt? That was because you were mouth breathing. And now we actually have a visual tool, or a tool that we can have them use to be relatable, to say those feelings are now behaviors. And those behaviors are creating obstacles for you that can really, or are really, impacting your ability to grow to your full potential. You're putting yourself in a higher percentage of chance for sleep apnea and for these issues. So yes, you're 100% right what it did. And we could do a whole podcast on my feelings about it.
Exactly.
But if we take that glass and, look at it from another perspective and another view, we can try to use it to an advantage of saying, listen, you felt those feelings you were feeling inside. It's because of this and this. So let me show you, and open that door. Sorry, that's
I've never thought of it from that perspective, and it really is so true. I'm all about the half full versus the half empty. So I'm glad to have that.
It took me leaving New Jersey and New York to start realizing I had to be.
Okay, that makes me feel a little bit better, I think, just a little bit.
So, the 36 years before, I was all like, do you know what you did?
Yes, completely. Yep, I completely get it. Absolutely. How would you guys say that myofunctional therapy has changed your lives professionally?
Oh my gosh. For me, I haven't practiced clinical hygiene since 2011. And so I actually kind of feel a little bit bad saying I'm a hygienist, because you would not want me to be your hygienist right now. I think Melissa feels the same way. I have not picked up an instrument, a scaler. I haven't taken x-rays. I would be very rusty. But yes, it was my background. I practiced for about 2.5 years. And then I just really, I was young, naive, single, and I made this career leap and pivoted into just quitting it all and starting my own practice in this field no one had ever heard of. It was not cool. It was not popular. It was not trendy in 2010. There were no, TikTok things about it. There was nothing on Instagram. It was such a different world. And Melissa and I talk about how far the field has come. And so it was a crazy thing to do. And, my family was like, are you sure? What are you doing? My family was very concerned when I quit my job as a hygienist. And Obviously now here we are down the road. It was a good decision, but there were some rough years in the beginning. So professionally, I mean, if you told me back then that, I would own two businesses, an educational business and a practice around myofunctional therapy, that people would want me to speak all over the world on the topic, that even just the way that the field has changed with research, and that, I've been involved in some of the research. I mean, all of these things professionally, I would have laughed if you told me that in 2010. I would just think, how is that possible? So, I mean, for example, even tonight, and I haven't even told Melissa this, at 9 o'clock my time, I have to give a lecture for the Malaysian Dental Society, and they're live. It's Dan and Donnie with Myofocus in Kuala Lumpur.
I saw they were there.
And they're like, Sarah, can you give us like a, TMD, like hour-long, in-depth myo perspective on that? And I'm like, sure, why not?
Let me just jam that in real quick.
I'll jam that in too.
Yes, between my vows and my travel, I'm going to jam in that lecture.
But I mean, that's the way that the field has changed and the world has changed just since then. So I think it's pretty incredible professionally what has changed in my life. So Melissa, if you want to share, I'll let you do your.
I think that's Sarah and I have so many parallels. Same thing. I actually don't normally go around using any part of my hygiene. I was a hygienist for maybe less than a minute. Once I was done, I realized I really wanted to be an orthodont. Like I really wanted to become a dentist and do ortho. And I struggled with school, with memorization. So it took me a lot just to get through hygiene. It took me years to get through hygiene, to be honest with me, to be completely honest. And then it was really sad for me because when I got through, it was not what I wanted to do at all. So I was really lucky that my good friend, Mike, who was an orthodontist, was like, don't be a hygienist, come back and sell ortho. And so I was already working, I was always on the treatment side and in the ortho side. So Myo gave me my life, like gave me my profession, right? Like it allowed me to shine and help people. And I use this example is that, listen, I always wanted to make money. I'm not going to lie, right? I mean, we need energy, we need that flow. It was amazing to be able to make money, provide for my family, and help people. For me, that was such a gift that I could do it. And I was doing it from such a place, like I really saw this, like I felt this pain that people were going through and I could relate to them. And I was so grateful. And then, as Sarah and I got closer as colleagues and then friends, and I talk a lot about her. She was kind enough to invite me. We had done a lecture together and she's like, oh, you should take my own mentor. I'd love to get your opinion on it. And structure for me, passion is something I have, but structure has always been an area I struggle with, keeping structure to my appointments and my sessions. And I took my own mentor and I remember like texting her and I'm like, oh my God, like, where has this been? And my own mentor really supported and gave me, and then that just grew our friendship and then our situation. So being able to collaborate and discuss and just work with great people and be able to have this communication and learn from each other has just been so epic and, so valuable to this whole journey. So for me, Myo's changed everything. And my kids, my husband, we pray to the mouth every night. Thank you so much. It's like the mouth literally feeds us.
Yes, exactly. And all its glory.
In all its glory, yeah.
We've definitely seen a big shift in Myo as well. When I started doing this in 2000 and I have to think 4, it was like I was speaking about voodoo. Like if I would talk to someone, I'm like, it's not like voodoo medicine, I promise. And
I remember talking to dentists in the early days, and I remember having some just say flat out, like, I don't believe in that. I'm like, this is not a belief system. Like this is like much like physical therapy is a thing. This is like that, but for the mouth, And so I just thought, who can say I don't believe in that? It's not.
So I ended up going out to Vegas because my mentors in New Jersey told me, like, you're better off out west. Go out west, go figure this out, and then come back. And I was thinking, like, who comes back to Jersey? once you leave, you don't come back, right? But it was true at that time. And when I mean, I'm really grateful to my husband when I said to him, like, I think the answer is the tongue. And he's like, what? I was like, I don't think, and they trusted. And so the voodoo of it, right? Like, of the tongue is more important than anything else. I was like, yeah, I think it answers everything. And then, how the functionality matters. It was so, I mean, I saw it so clearly, and I'm assuming that's what all four of us have in common. Once I saw it, I couldn't not see it. And everything made sense. And it was really hard in the beginning to understand how no one else saw it. I was like, what do you mean? It's not about you not believing it. It's right here.
Proof is in the pudding.
Yeah, proof was definitely in the pudding. And it was difficult. And being able to go out west and even still get some pushback, but a little bit more open. And, Sarah's from the Seattle area. So, and she was even getting pushback. And that's one of our most highly accepted markets, right?
Number one and number two behind Los Angeles. So,
yeah. So for you guys, I mean, Jersey's bad. Long Island, gosh.
Yeah, so true. So true. You are 100% correct. 100%.
They don't believe it unless they hear it, see it, feel it. My uncle's fine. My sister.
Yeah. Where's the research? Where's the research?
Where's the evidence?
And the best is I always
pass along to
all my family in New York. I said, like any of you are going to read the research.
Yep. And then it was all coming out of Brazil. And then it was like, well, where's the U.S. research? I'm like, I don't know. This is what I got right now, but I'll bring it forward the ass when it comes in.
But now in the last, I would say 5+ years, it's just such a shift. I mean,
such a shift.
I've been working with Janine since 2011. And when I first started on, it was the same thing, trying to get to the orthos about why we maybe didn't want that habit breaker put in and we wanted to try myofunctional therapy instead. And it was such a back and forth conversation. And now it's just like, our myofunctional patients are coming from the orthos, from the ENTs, from the dentists, instead of us having to send to them, they're coming our way, which just shows that.
That's
even
amazing.
the local dental schools for a period of time, some of them would say we do focus on myofunctional therapy and we include it in our educational pieces for dental professionals, where other schools would be like, nope, we don't, our school doesn't believe in it. So it was so based on who was running the programs, the president of the university.
Absolutely. Actually, at NYU, the pediatric president, oh my God, what was his name? He's in Brooklyn. Anyway, he was one of the first people when I was doing work with MyoBrace. I would spend a lot of time with him in New York, and there was a lot of open-minded. Barry Rayfield, he's just so amazing. I spent a lot of time with him in Jersey, and he was such. I mean, when I talk about a pioneer in our world. I mean, I was at dental conventions where dentists were literally like saying he was nuts, and yet he would get there and be in front of everyone and just stay confident and just constantly not give up on the message. And it's, so much gratitude goes to so many of those guys, those doctors that wouldn't give in, and people like yourselves. It really makes a difference we really are making a massive impact for patients' lives, right? And you're changing the status. You are changing it. You're changing all of it. You're changing the way medicine's been practiced and the way we look at things. It's really miraculous. It takes about 30 years to mess it up, or about, maybe 10 years to mess it up and about 30 to fix it.
Yes. I'm just hoping we're in that, 30 at this point.
I don't know if I would go there. I would say we're maybe at about like year 18 in the 30s.
Okay. All right. I'm good. Yeah. Hopefully I'll be retired by the time we hit that 30 mark.
Yeah, exactly. But think about the world we're leaving for the next generation, right?
Okay.
And I know that's something I hope that our the pioneers in this field realize, that us, younger generation, that we really do honor it, and we are really able to bring it to the next level to keep growing it for the people under us. And instead, I do sometimes think some of our senior colleagues tend to be a little more
closed off.
My baby.
Yeah,
definitely. You're not getting my information.
Yeah, even therapists that we bring on, and we train, we're always, you have to believe in the process. If you don't, I don't want you practicing something that you don't feel has a benefit, because you have to believe in it in order for your patients to believe in it and to be able to make that difference. So even just having people that are open-minded to things like that is a struggle to find also.
So as some of our listeners may be registered dental hygienists themselves, maybe not fully in the world of Myo yet, what would be some things that you would say to them in terms of, you have a child or an adult in your chair doing a dental cleaning? What are some of those red flags that they could look for that could tell them that there may be an oromyofunctional disorder present?
Gosh. I'll answer it from the point of somebody who doesn't even know how to identify a tongue tie. So I would say, first of all, look for a tongue tie. But if you don't even know how to do that, or you don't understand like the newest, latest, greatest grading scales, then that'll be too hard. So I would say any patient that really struggles with the water, so the suction, they need to hold the suction, or they can't be tipped back all the way, or they just really struggle with the water in the mouth and how to like breathe and swallow. And if that's a very stressful experience for them, that's one sign. I would also talk about patients who really have a lot of facial muscle contraction. I mean, all the hygienists would recognize this. People who really have like strong lips, strong chin, like their cheeks are really tight, and it's almost like they're fighting you when you're trying to get your instruments in their mouth. Those would be two signs where, if you know nothing, those would be like a good place to start, like those patients. I don't know, Melissa, what would you add?
Yeah, from my end, from a clinical standpoint, I always tell hygienists, start looking at recession, start looking at perio situations. If you're noticing heavy pockets, a lot of recession, and you're looking in the lower anteriors or up on the thing, start noticing where is that tongue sitting, and is the tongue almost showing you this, like, is it pointing you? All of that is side effects of poor myofunctional disorders. Heavy grinding and clenching, obviously wear and tear on the teeth. Also, people that literally, when you ask them to move their tongue, it appears as though their brain and their tongue do not speak the same language. You know, when you're saying to a patient, okay, I need you to move your tongue over to the left, and they're not getting it, right? There's a reason why. There's an actual disconnect there. And that's always a red sign for me. People that are showing constant decay, and but you know that, and they're saying to you, "I'm brushing my teeth. I don't know what's going on. I don't eat sugar." They're not lying. A lot of them are mouth breathing, and the problem is those antibodies are fighting other things, and so therefore they're more prone. I was definitely those people. People that have very small vertical bites. People with tiny teeth. They have myofunctional disorders. They have airway issues. Sarah and I, we say, like, look at their face, get out of their mouth a little bit, right? Like, if you notice they have a lot of dysymmetry, they do a lot of Botox and fillers. There's usually why, because some muscles are being used than others. Ask those things. If you notice they really struggle being able to keep the lips closed, pay attention to how they speak. Do they speak quickly? Do they speak slowly? Are they constantly choking, clearing their throat? All of those things. You can learn so much by just having a conversation with somebody and just watching. It's literally just picking your eyes up, taking them out of your loops for a minute, and just get a little peripheral and just look at the whole situation and kind of notice and listen to them. When you're reading that health history, notice, are these things connecting dots? Wow, okay, wow, this patient has digestive issues, and they're clenching, and they have small teeth, and they have recession. Wow, I bet you there's more going on here.
I think the clenching and grinding is such a big one, because in dentistry, we all know how big of a deal that is. Like, dentists give out night guards, like, to every other patient. Yeah. And so if you just, even to make it super simple, like, who clenches and grinds, who complains of like TMJ issues, headaches, that kind of thing, those patients all have underlying myofunctional issues. So that's a good one too.
Are you assessing even the labial frenum in those situations, or would you recommend dental hygienists be really observing the labial frenum as well, or just the lingual frenum?
It's so hard.
I'm going to be very, I like to keep things simple. Okay. So the problem is, as hygienists and as medical professionals, everybody loves to complicate everything. Like, I'll listen to some of these podcasts, and I'll be honest with you, they bore me. And I'm like, okay, that's, the truth is, if you make somebody's job harder than it already is, right? Most hygienists are already struggling with the time they're given. They're given an hour to sell a product, make sure they do this, keep the production up, keep the patient happy, clean the teeth, all of these things. And then you add this on, it just feels so much. So don't get lost in the tissue, if that makes sense, right? Like if that little saying says, pay attention to what's affecting the patient in their actual quality of life. Then look at the tissues. The tissues will lie. Everybody wants this science, right? Like, okay, the measurement's so important. I laugh during the things. Everyone's like, oh, I think I got the numbers wrong. I'm like, who cares about the numbers? You guys are getting so giving yourself your myofunctional disorders are coming through because your anxieties are like, I need the numbers. I need the right measurements. I'm like, I haven't, please relax, because it's about the dysfunction and the behaviors, right? You're going to diagnose and treatment plan well when you find out what's affecting a patient and matters to them, right? Yes. If you only push science and what you see from a clinical end, that's going to go in one ear and out the other on a patient, because they're just trying to survive. They're thinking about their bills, they're thinking about Christmas, they're thinking about this, they're thinking about how much this cleaning is going to cost, how much, blah, 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 blah. Plant seeds that are going to matter, and you don't have to do everything in that one visit. Start planting seeds, start documenting, write notes, and listen. And then when they come back in 6 months, notice if those same things are present. And then if they are, circle, say, okay, it's time to talk to this patient about this. Don't try to educate and teach everything in 5 minutes. You're going to leave something out, and then the patient's going to get a bad taste in their mouth. Yeah. So I think it's really, the best advice I can give anyone is just look, get to know, visualize it, and then slowly plant seeds. And then as it goes, go from there. So yes, the tissues matter, right? Of course, when we're talking to other colleagues and we're sending out, hey, listen, I really think I need the lip tie done. I think I need the tongue tie done so I can get pure function. But when it comes to the diagnosis and the talking to the patient, all of it is fair game if it's going to help the end cause. So knowing where you're going to go really matter. That will help you decide what you need to do. But a lot of times I find most dental professionals, and I obviously I can't speak on speech, only on our areas, we get so caught up in trying to prove to you what we're seeing wrong so that we can then convince you to fix it so then we can treat it. And I really think that is a big disservice we're doing to this movement and for our patients and for ourselves as providers. I think we're setting ourselves up for a much longer haul than needs to be.
We just have to basically figure out what matters to the patient, what bothers the patient, and that's going to solve the, should I do therapy problem
for them, and then how can we support that?
Absolutely. Yeah. What kind of structural changes do you see in the oral cavity as you're working with patients doing myofunctional therapy?
Oh, I see arch expansion, right? We see all kinds of change, dentition movement, jaw positioning. I mean, those are just some of them to start on my end.
I think especially with kids, some of the interesting things with adults that I've seen is like the palate smoothing out. Have you guys noticed that? Like the rugae getting less prominent, more smooth just from the tongue going against it. I've seen open bites close to some degree. I think Melissa and I are careful in our evaluations to specifically not promise that type of stuff because yes, it's possible some people get amazing visual before and after pictures and they have incredible changes to like the way their eyes look brighter and their smile lines better and their palate looks wider or whatever. But at the end of the day, a lot of patients don't see any changes, but they feel better. We know their tongue is up more, they're breathing through their nose, they're sleeping better. And so I always caution my students, especially, like, don't get too hung up on having like amazing changes to before and afters, because you can still be very successful in therapy without being able to see that much of a difference on the outside. So I don't know what you want to add.
It's that qualitative versus quantitative in terms of changes.
So, I think in myofunctional therapy overall, people want to see those structural changes, right? But, staying in the 3 pillars of remembering that it's structure, function, and behavior. And most of the biggest bang for your buck comes in the behavioral changes, the self-awareness. Mm-hmm. So when I think of a patient and I'm like, what did they get out of this? Is that they now have the tools and the understanding and awareness to navigate and kind of get ahead of something when it's starting to affect their structure. So an example, you have an adult patient that's really going through a stressful season in their life for whatever that reason, and their natural habit is to go back to severe clenching. Now they know the awareness, and they know the kind of the points of what are the side effects that are coming, what's brewing that can aggravate it even more. And now they get ahead of it. They know they can go back to do their tongue suction, or they do some clicks, or they pop in, some type of a chewing appliance, whatever the protocol has been set up. And now they can kind of get ahead of it before it becomes so predominant. And now they lose another 0.5 millimeter of vertical on the anteriors. And now their lower jaw goes distal 2 to 3 millimeters. And now you put them even more severe into sleep apnea. So those to me are really the biggest changes, is when somebody says to me, when a patient comes back and goes, wow, my friends and my friend's mother's a mouth breather, and I can't even meet with that person anymore. And I'm like, oh, okay, you're done. You're good.
Yeah, because diagnosing their family, their friends, their girlfriend, their boyfriend.
Yes.
That's a good sign.
Yeah. Because, we can promise, we're very with our therapist, Sarah and I really are, but there's no magic. This is not a magic bullet. This isn't a secret sauce. It's about self-awareness and teaching people about good versus bad behaviors that have really long-lasting structural side effects. Mm-hmm. And when we're able to coach and navigate and give them realistic expectations and keep things moving along in a way that makes sense, mm-hmm. that's when we're doing our best work, and we're setting the doctors up for success, and we're communicating on a higher level. That's when we really make big changes. And then this work is just so magical, mm-hmm. because we're setting it up in a better way. So not to go off your question, but I think Sarah and I'm sorry, I don't mean to speak for you. We try really hard we say that there's possibility for major structural changes, but that's not why you're doing it. And if you are coming into Myo because of that, then you'll probably be very sadly disappointed, because we're never going to be able to meet your unrealistic expectations. Mm. So where we've changed a lot, I think, from where I was 12 years ago, I used to show all my cases. Look at all these changes. Look at this. And I would sell it. Mm-hmm. I don't do that very often now, because I do not want any of our patients to have unrealistic expectations.
Oh, I stopped doing it too. I was like, I don't want to even show before and after pictures, because then patients feel disappointed when they don't have these like amazing, before and after photos that they can look at. Mm-hmm. And even the same way that Melissa and I set up our tongue tie patients, there are people, and you can find YouTube videos of it, who have their tongue tie released, and they have tears of joy, and they're like, life is changed. And, they have these incredible experiences, but that's like one in every, 15, 20 patients. Mm-hmm. So we don't want patients to think that that's what tongue tie surgery is. And if you don't get that experience, then it didn't work. That's not true. That's actually like crazy. And so I think we've just got very good at setting up what are the goals of therapy? What is our job? And then what are the roles of the other professionals that we work with? And what's a normal experience, a normal outcome? And then what are these like amazing things that can happen, but they probably won't happen to you. If they do, awesome. But that's how we've really tried to talk about therapy with patients and try to make it a little more realistic.
In a world where everyone is looking for that instant gratification or that magic pill, what would you typically tell a patient that becomes discouraged during the course of therapy and doesn't want to wait to see everything come to fruition, so to speak?
So I'm sorry, I'll start with that one.
Start.
So first I would say I'm maybe a little harder on us as therapists. I kind of tend to put the mirror back on us. Mm-hmm. I would ask myself as the therapist, or ask you as a therapist, is what did you do to set that patient up where they're getting lost, right? Okay. Because one of the things Sarah and I really have changed a lot over this last year and a half, 2 years is, if you listen to my consults, tongue ties I acknowledge it. I tell them the grade of it, but it's the least of my conversation. They could be tied to the floor. I got very far away from that because the tongue tie is just one part of something for me. It doesn't make or break anything. If you are a really good therapist and you're looking at all the functional and you're setting it up properly, yes, the tongue tie will help us be able to get that patient to achieve results, more desirable results. But I always kind of now prepare myself or prepare our therapist to say, what if that patient doesn't do the release? Do not pigeonhole yourself to not being able to execute this therapy with or without that tongue tie release. Because if you do that, you're going to fail. And you have a very high chance of disappointing that patient and not being able to achieve what you said you could do. And that was a hard lesson that I had to learn, right? For a lot of times, because I had many patients that were getting discouraged, that I felt like the joke is this. When I looked at my son's birthday party and like half of the birthday party were patients because I had to become best friends with them. So because I felt so guilty because I didn't know how to finish, right?
Right.
I'm like, I think there might be a problem with my therapy.
What am I doing wrong? What am I doing wrong?
But that was a hard lesson, right? Like I had to look in the mirror and take responsibility for that. And then, me and Sarah would sit and talk and she'd be like, no, I hear you. And then we really worked on that.
A lot of that came from this amazing shift that happened in the field. I would say after 2017, when that Audrey Yoon, Dr. Zaghi study was published on the new grading scale. So the new TRMR classification system. Now I had this official formal, are you grade 1, grade 2, grade 3, grade 4? And from that point forward, it's a good thing, but everything got so focused on the tongue tie and the tongue tie release that a lot of patients started to think the whole point of doing therapy is just to have that surgery. And so Melissa and I talked a lot about that because we realized that our own language had shifted to that. And we were like almost selling the therapy to patients as if it's all about the tongue tie and everything revolves around that tongue tie surgery. But the tongue tie surgery is one step along the path to getting the optimal function. And, it's going to be different for different patients. And obviously, yes, me and Melissa, I don't want anyone to think that we don't think a grade 4, really bad tongue tie should be released. But we're just trying to flip the conversation where it's more about function and the bigger picture and not just make it all about that tongue tie surgery, because that's kind of what's happened to the field is everything's about your frenum, your tie, and your surgery, and the rest of the therapy is just it's just there to get to that, which
isn't true. I appreciate Sarah saying that, and I appreciate her making that point. It's definitely not that we're acknowledging it. What I maybe left out was is that I want the therapy now where the patient is actually like, okay, when am I getting this release done? Because I can't do the therapy the way I want to do it because I feel the tie now. Yeah. I feel where the restriction is. And they're like, wow, once I'm done with this restriction. Yeah. Mm-hmm. Yeah. And once we can have that shift where the patient is like, okay, I can't wait to get this release done because I know it's going to allow me to decrease my compensation patterns, or, oh, wow, I'm going to be able to do this. Like, that's when we feel like we're not telling patients that they have to have their release. They're saying, I know I need to have this release. And when you have that mindset shift, the patient is excited, knows exactly why they're getting it. They know what they're going to get out of it. They're going to come back to us and they're going to be like, oh, look at what I can do now. And it was a win-win. They're not like, oh, it didn't work. I didn't notice a difference. And now I'm trying to prove the tongue tie worked game. Yeah. Or trying to convince mom or vice versa. We're all speaking the same language and we have this collective kind of end game in sight. It's such a nicer way to transition your therapy. And it's a better overall experience for the doctor, for us as therapists, and for the patient. Of course, it's not every single time it's going to go perfect that way, but if we keep that mindset, it really does. It has made a big difference. A lighterness to the therapy session, and it just feels a little bit better.
Right.
Well, and Melissa and I, that's okay. I was going to say, we're also in this kind of unique situation where Melissa typically does the consults at Faceology, and most of the patients that sign up for therapy with us, they're going to see one of our other therapists. And so for us, it's also about making sure that our team is set up for success, because if these patients aren't prepared well in the consultation, then we hand it off to someone else. That's really where we've learned that we have to get everyone on the same page, because we're not even necessarily treating the patient that we're having these conversations with. So our team has to feel good about, what they're walking into, providing the therapy, because that's, we don't want to put our own therapist in a difficult situation and have bad experiences with patients. And so it gets more complicated, I think, in even that scenario too.
Absolutely. Yeah. Everyone's success looks different, and everyone's path to success is so different. So it's just about treating the patient, fitting a myofunctional program to the patient, not a patient to the myofunctional program. So
true. Well said.
Okay, so I know that we had mentioned that you guys do a lot of lectures around the world to other professionals, to the other providers on what myofunctional therapy is. Janine and I do so as well. What is that looking like for both of you now with that shift that we've spoken about? And are you finding that more professionals already have the background and just want to know more? How would you say that is?
I think Melissa and I both kind of joke, like we have two types of speaking gigs that we like sign up for. One are things like the American Laser Study Club, the AAPMD annual meeting. These are lectures that we go to, and it's all preaching to the choir. Everyone knows everyone. We all are on the same page. No one's questioning or doubting or asking, where's the research? Everyone's there. It's kind of like a family reunion. And so that's one thing that I like to do that. I like to speak at those events because it feels good. It's fun. But the other type is where you're actually doing more good for the field. So harder though, because it's not necessarily that you're getting all, like, can I get my picture with you? And, oh, I'm so excited about all this stuff. It's much more, you might get the questions, where's the research, and how can you practice this as a dental hygienist when you're not working under the supervision of a dentist? And I'm like, oh my gosh, I haven't had that question since 2012. Okay. Let me figure out how to answer that again 10 years later. But yeah, I think it's those types of opportunities are really good to get the message to grow. When we go and preach to the choir, we're not necessarily helping more people understand what we do. And so I mean, I like to do both, but I have very different intentions when I speak to a brand new group, like I did at the Pacific Northwest Dental Conference last month. I spoke to, over the course of the day, about 1,000 dentists and hygienists and dental assistants, which was really amazing. And a lot of people, I always ask at the beginning of the lecture, I'm like, how many of you have heard of this before? How many of you have actually worked with a myofunctional therapist? And, I try to gauge the audience, and, it's a mix. In Seattle, it's a unique area. There's actually a lot of awareness, even though people don't necessarily know what it is, they've heard of it. But even then, at the end of each lecture that I gave, people come up and they're like, I can't believe I didn't know about this. I'm so excited. I know my son, my husband, my whoever has these symptoms. And so it does feel good, even though you get some of those like doubters. And, there is, I should say, we all keep talking about the research. There's actually a ton of research now that's come out within the past like 5 years, maybe 7 years. But we do have a lot of great supportive research connecting myofunctional therapy and tongue tie release to sleep apnea and, all sorts of airway issues and orthodontic support. And I mean, there's a lot now. And so that's why I kind of laugh and joke when people are like, where's the research? I'm like, Google it. There's actually a lot now.
Yeah, exactly. The research could be your case study when you're working with a patient from beginning to end. You've created your own research. And you see that.
There you go. That too. A clinical experience, and being able to take one case and that's how research starts a lot of times, is with one case, and then it leads to a case series, and then it leads to so much more than that. So
Absolutely.
I don't know.
Is there an age at which you would start therapy? And is there an age that you would say, okay, nope, it can't be fixed?
No. I mean, age-wise, I think Sarah and I guess there's two ways. I mean, for our personal practice, for faceology, we try to nothing younger than 3 or 4, just because of the type of programs we have set. But I think in general, you can do different types of OT very early on. And for me, there's no age that's ever too old. I think my oldest patient is 89, 90, and it's an edentulous patient that has dentures. Wow. And we did a ton of work to help them be able to sit and work better with their dentures and be able to wear them. So there's never a time you can't fix it. As long as they're living and breathing, I think they can still do it.
Yeah, I actually talk about the symptoms are the same. The treatment might be different. So it's the 0 to 3, 0 to 4. That is a lot of times more what you speech pathologists are much more geared to treat with oral motor therapy, feeding therapy, that kind of thing. And then younger than that, it's lactation support, and so the symptoms are there, but kids really can't do the true, what is myofunctional therapy? It's like me giving you exercises that you can understand and practice on your own and repeat. And, when the kids are 4 or 5, obviously they're going to need help from their parents, and even up until like 10, 11, 12, a lot of times. But yeah, I think the symptoms are there at whatever age. It just might be in the young ones, a slightly different modality to treat it. And I mean, faceology is adult focused. We haven't made the decision to fully say we don't treat kids, but because that's hard to alienate a population. But our specialty, and really what I think we're best at and what our therapists are so geared up to do, is adults with airway issues, TMD issues, sleep apnea, snoring, pain, clenching, grinding, all sorts of problems. And they're adults. I would say they're 30s, 40s, 50s, 60s. We treat young adults too, but that's really, it's the people with the big problems, the pain and the sleep issues. That's really who we specialize in and see the most of.
And I think that also goes to say is, another part of my passion when you talked about education, or like the people that we're lecturing to. I think my particular area of specialty when it comes into it is probably a little bit more direct to doctors for implementation. That's really, never mind the the consulting side for me has been a really part of my career. Never mind my myo stuff. I'm working with Sarah. I do a lot of consulting as we're collaborating that. And that's for doctors that are the professional that has heard about it, is interested, but has no clue how to get has no clue how to get their team on board. That's probably one area that I've been very strong in and have had a lot of success, and have a lot of positive little tips and trades of how to, maybe that's a niche, right, of how to implement to get your team on board and how to, and really set it up for success within your office. So that lies to the question where I think if Sarah and I, in a perfect world, and we're not saying that faceology isn't seeing kids, I would love nothing more that we have a perfect practice, because I do think younger patients really do well with appliance support as well. If you've ever heard me lecture or speak at all, appliances is kind of what everybody thinks. They're always like, oh, Melissa Mugno knows a lot about ortho and appliances, which I do. And I do think appliance therapy and support works so beautifully with really great therapy and a really great, full collaborative plan, really hitting the structure, the function, and the behavior. So I think Sarah and I always would love to do that therapy hand in hand with the right office, and having somebody on, in hand and be able to see that patient and work with them on an appliance side as well. So I think that's where it kind of gets a little bit patient selection and what the outcome needs to be. And I think that's where it's really helpful for therapists to be very educated in appliances and different tools that are out there, so that they can help navigate and set up patients and lead them properly. Sarah likes to joke that I should coin my favorite phrase, is that I believe what sets us apart at faceology is that I really believe that I'm an airway traffic controller, and I really build all of our therapists to be the same way. And that means it is our job to navigate, support, and make sure these treatment plans take off and land properly. And that means to be a really great air traffic controller, you need to know all the patterns, all the paths, all the routes, and know all the things. It's not because you're going to go fly all the planes. It's not because you're going to do all of it, but you need to know all of it so that you can navigate it properly. It makes a big difference to know that.
Something, Melissa, that you've tapped into that I think the speech pathologist might kind of get, a kick out of is us dental professionals are not therapy oriented. And so to try to get like professional who is very educated and very good at what they do, but we're used to doing procedures, treatments. You do it one time and it's done. The patient pays for it once and it's over. And so Melissa has had a lot of success helping with the implementation side of things, because it's really hard for us dental professionals to wrap our heads around how to do therapy. And therapy is gray, like one of the biggest questions we get asked on our discussion calls that we do once a week with our students is, if the patient doesn't do well with one exercise, do I repeat it or do I give them a different one? And it's because they want like this structured, like I always do this and then I always do that and then I always do this third thing. But therapy doesn't work that way. And it's very just like flowy, and you have to react to the patient in front of you. You can't have this pre-programmed thing that you always do with every person. And so for us, I think both Melissa and I have been successful because we've tried to help dental professionals get out of that, like that black and white A, B, C mindset, which is really hard for us. So,
when it comes to speech, I have to say this last couple years, I've been really honored and really grateful because I had a lot more speech presence, one with my son, as well as when I moved down here, I was able to start working closer with this one speech group. And, they kind of asked, I could tell there was like the elephant in the room. And I looked at her, I go, you can ask the question, like, you think you should be doing this, not me. And she looked at me and she goes, well, I go, no, I go, let's be honest. My jersey came out. I was like, let's be honest. I said, I go, so let me tell you why I think you fail, right? And where we both need each other. And she said, and she now, she got her, I in no way, any hygienist, you're right. You guys are the function queens, right? You're the queen of the function.
Therapy.
But with the therapy, with understanding how to engage somebody to get them to do certain things, hands down, we can't touch that on that space. But where we as dental professionals are really strong is the tongue toning, the tongue placement, and knowing the oral cavity better than anything. So I know the environment, you know how it works. So together we're better, right? And I said, in your perfect world, you have a myofunctional hygienist who is guiding and looking at the treatment plan, learning how the environment has been affected or will affect the outcome of the mechanics of the ability, how the tongue's going to move, how all that swallowing is going to come into play. And then you have a really strong speech myo idea, looking at the plan, realizing what's possible and what's not possible, and how they can create the machine to do it. Together is always better. And it's because it's coming from two different strengths of the profession. So, I think the more we all get in the rooms together and talk, if you just kind of like take off the robe and just and call the elephant out, there is this beautiful way of saying like, wow, we both bring such a unique set of skills to the table and together better. I mean, my son has the best of both. I'm lucky enough. I pay for a really great speech therapist for him. And I say to her, this is what I'm working on to keep his tongue tone, tongue placement. You do everything else. We piggyback all day long on him. And where he's come and what he's done is so much better because he's getting the best of everything, right? Like, and well, he's getting the best of you. I'm not going to say I'm the best of getting him to do it all the time.
Your mommy, you're the teacher, yes.
But I'm so grateful that she respects like how I am and vice versa. And so we've kind of just working. And I said to her, I go, do you know that you're going to be one of the, like, because you've allowed me to just show you how I would do it. I can see patients in our little town that are working with her. I can spot them a million miles away because she'll know to say, hey, listen, what's going on? I don't know what's going here on the arch. I think it's affecting the lateral borders. I don't think I can get him to hit that or her to hit that side, because is that crossbite causing me that issue? I go, absolutely it is. Right now, that's helping. That's going to help the speech move along. It's going to help her be able to get to her end goal. And now at the end of the day, come on, parents say bad things about speech therapy. They'll be like, oh my God, my kid's been going to speech 3.5 years. I think I bought that house.
Yep.
You know what I mean? And vice versa, right? So there is so much we can learn from each other if we can support and collaborate. And that really excites me. I think there's so much to come down the pipeline with collaboration within our two professions.
Absolutely. We always, with myofunctional therapy, it's always about collaboration. So whether it's with the ENT or the dentist or the ortho, it definitely should be with the SLP and the dental hygienist, both functional therapists.
With a post-pandemic, I think we could say that now, and I pray, in a post-pandemic world, or also in a world where there aren't myofunctional therapists readily available, where do you see virtual therapy as a piece to the treatment of patients that maybe don't have access, or when we were all shut down in quarantine and no one was moving anywhere, in that type of world or that type of setting?
Well, we think that's what Faceology is already doing. It's changing, it's elevating the online treatment. As Sarah this is her domain. She was the first to create it, right? She really was the pioneer in online myofunctional therapy. And I do think I'll speak on my end, I was actually quite the opposite. I was the furthest from the online myofunctional therapist. I was the one, as Sarah says, on the boots in the office.
Boots on the ground.
Us together now bringing both of those to the online platform. I mean, when we sit in our meetings, and trust me, half of Sarah's life now is sitting in meetings. But I'm always acknowledging and bringing to the table the idea or the viewpoint of like, wait a minute, what are they missing? How are we going to be able to achieve this that maybe they would lose in person? And I personally think where Sarah is so amazing is that she can take something that I say, or she'll go, okay, let me think about that. She'll come back and she'll be able to navigate that and go, well, we can do it like this online, or we can train them on this. And that to me has been really beautiful. And I think we're really working hard, dedicating a lot of time, money, and effort to elevate this so that we can offer some of the highest quality therapy that I think we both are. I want the other professionals to be like, wow, what you guys are doing at Faceology is impressive. And you're keeping the respect and the transparency and the clarity and the authenticity of our profession on a different platform. And that's where I look at it anyway.
Yeah, online therapy is hard. I mean, I'm not gonna lie. I think a lot of people had that realization because of the pandemic, that like, how do you see things and how do you know? And so it's an entirely different skill set. You can be a really great in-person myofunctional therapist or speech pathologist or probably any therapist of any sort. But as soon as you move that therapy to a screen, it's a different skill set. It takes different communication skills. You really have to be understanding of your technology. Like you have to know how to operate Zoom backwards and forwards if you're using Zoom. You can't expect patients to know anything about their technology or their lighting. I mean, all of these things that we've learned were things that I struggled with for a long time. I mean, I started my practice in 2010. That's when I first started seeing patients, and I saw patients in person for 4 years. And then it wasn't until the end of 2014, maybe early 2015, that I said, I'm going to take this fully online. And so I did that, and I got a ton of criticism, which I understand. I mean, patients loved it. I will tell you, the reason I did is because I was in a very technology forward area. I was living in Seattle. People were like, I don't want to sit in traffic. Why can't I do this on FaceTime? I don't want to drive, across wherever to get to you. Why can't I do this on Skype or whatever? Back then we were using Skype, and it's come a long way. But
yes.
I kind of figured out a lot of the challenges around it, you have to take the in-person skills and blend them with that online experience. But I completely get where the criticism comes from, because the first 50 times you do it, it's difficult and it's frustrating, and like it takes a lot of experience doing it online to get good at it. So I think it's possible to provide really high quality, high level therapy. It just takes a lot of practice doing it that way. And so that's what we've done with our team, and Melissa and I, we obviously have a lot of experience with it, but the first time you do it, you feel like you're not able to do anything, and it's really difficult. I don't know if you guys have had that experience, but
yes, and the same thing, lots of criticism, but and education, so to speak. And I think from both sides, some parents, especially even parents, will say like, in-person therapy is always better. It depends on the situation, the needs, the what's happening, the child's behaviors, the environment that he's in or she's in from at home versus being in the office. We even see there's behavior management. If the parent is not sitting there with the child, are they pressing buttons or, playing on their phone? Or so it's like you said, it's just switching your mindset because you don't have total control. You have to kind of make sure you're taking your cues.
Right. And with that older patient, being able to explain, okay, I know what I would do. I would take my hand right now and hold your jaw, but I can't do that. So how can I tell you to do it?
Exactly. You pretty much have to teach the patient to do things that you would do if you were there in person with them. So I love it. Now I feel awkward. I was telling Melissa the other day, I'm like, when I do go into a dental office setting and I'm there one-on-one, like doing, consulting or just whatever I'm doing, and then I have to like be face to face with someone, I'm like, I feel very awkward doing this.
Do I need a mask? Am I 6 feet apart?
I would be so much like more comfortable doing it on the screen now. So it's just what you're used to. And so I do understand where the criticism, either from parents or providers, where it comes from, because it's different. It's new. It's, if you're not used to it, it's hard. And so I get it, but I think we do a great job at it. So
and I think the other thing is it's actually testing you. It's forcing you to create the patient to kind of monitor themselves and be able to execute. And realistically, it's not easier in person. It's easier for the short term, right? But the actual long term of it has to be, to get someone to be really good at therapy is they have to be able to do it themselves. So this idea that I wish I could do, it would be easier if I could do it for you. Well, no, then it's just going to make the therapy harder for them. It's going to be hard one way or another. So let's use the example real quick of the behavior situation. So you have a patient or a mom and you have a child that their mom's not there, not paying attention, and they're not doing it. Well, let's be honest. Let's call it out. That mom's probably not really going to be there when they practice either. So the chances of being able to get that patient to achieve the goals are probably pretty low. So where I say now, I almost challenge the therapist and I say, is that maybe a patient that we should release? They're not ready to do the therapy because if you're spending all these sessions doing behavior, well, then there was no point of doing it anyway. You're actually wasting your time. You're wasting theirs. You could be making more money with the patients that actually want to be doing it. And vice versa, you wouldn't have that patient discouraged or kind of disgruntled because they don't think what they want.
When patients come back like, well, it didn't work, or I wasn't happy, that's like the worst thing to me and Melissa, because we're like, we pour everything, like our heart, souls, everything, probably like you guys too, into that therapy. And so we know that there's a disconnect, and luckily we haven't had that happen in so long. It's nice because we are so good at setting people up from the beginning that if the mom or dad or whoever is on their phone during the consultation, then we're pretty good at saying, this therapy is difficult. It takes a lot of parent involvement. You need to practice this 10 minutes a day at the very least, with your child. I mean, Melissa and I actually are really good at, we make the parents do the exercises too. So, I mean, they're fully engaged and accountable, and we're pretty, I almost try to push people that I'm suspicious of that, are they really going to do this? I almost try to push them away and say, this is hard. It's expensive. It's time consuming. It's a lot to commit to. You have to decide if this is the right thing for you. And it's not because I'm trying to be mean. I just want them to fully understand what they're getting into and have to take that step forward. Melissa and I can sell therapy all day. We can probably get anyone to sign up for it at this point, but that's not a good thing. We don't necessarily want everyone to do it because they're not going to be successful. They're going to get 3 or 4 sessions in, the newness wears off, they're not
wears
having fun
off.
anymore.
Yeah. Mm-hmm.
Now it's they don't do it, they don't practice, they don't get results because they were sold, quote unquote sold. Melissa or me, we were good at convincing them to do it, and so they did, but they weren't really buying into it.
Right. Yeah.
Which is actually, Sarah, you're right. I mean, that's almost kind of like the double-edged sword. Sarah and I are both so good at doing consults. I can pretty much convince anybody
to do it.
I hate to use the word convince. I can educate pretty much anybody on their myofunctional disorders and show them a way that could fix them and benefit them without a doubt. And I think I could do it pretty well. But the realization of that is, because I can show it to them or convince them that they should do it, doesn't mean that they want to or that they will.
That they're ready.
And then that will create a patient, a provider per patient situation or a treatment that isn't going to actually help anybody. And that's going to turn into an area of constraint for myself or my therapist or for the practice, because that will be the patient that's unhappy, complains, asks for money back, and then creates unnecessary havoc. But realistically, like I was saying to you guys earlier, that's on me. I should have been better on that. I should have known the cues and the signs. So patient selection's a really big deal. Knowing who you're doing it with and who you're selling it or bringing into this treatment is important for success. But
we always say that we're only as successful as the patients we can successfully discontinue or successfully discharge. We could have a million patients that come in, but if they don't end and resolve their issues, then we weren't successful. So they get tired of hearing me say that, but that's what I say.
No, it's super important. And that's probably why you guys have seen the success you have, because you're actually paying attention to the end, right? A lot of people are so worried about the beginning, they don't even think about the end. And the end is really everything. How you're going to wrap it up, how you're going to take care of it, where they're going to move on and graduate really matters, because that keeps the ebb and flow of the whole practice. So, I mean, I think that's such a beautiful thing and really important, and sets, I think, the successful ones aside from the ones that are maybe struggling to get themselves into a successful position.
Agreed. Absolutely. All right. One last question. We promise. It's you, Miss.
In terms of, as myofunctional therapists, one of our biggest focus is that tongue and making sure that it's resting correctly in the oral cavity. Tell us a little bit about what you are seeing in terms of the benefits of proper tongue resting posture, and the impact that it could have on a patient, including their sleep and encouraging nasal breathing. What are all those positives of proper tongue resting posture?
Want me to go first, Melissa?
Yeah, you can start on that one.
My whole pivot in the field, which I'm so happy to have research around, I kind of make a joke that back in the old days, 2010, we were just talking about like tongue thrusts and do you want to have good looking kids or not good looking kids, a beautiful kid.
Yes.
Like that was what people
oh my God, there's a few videos on YouTube and they're like, look at this unattractive face. I'm like, oh my God, how do we say that?
I know. So I'm so happy.
Such a Dr. Hank thing to say.
It is.
Yes. This unattractive face.
Hold on real quick. I adore Dr. Hank. So please.
Yes. And they're so informative. It's so informative.
It's so true. So I'm so happy that for me, and it's different as a speech pathologist, I think, but in dentistry, our domain is the airway and, the TMJs and the clenching and grinding. And so I've been so happy over the past, 5, 6, 7 years that we've had research supporting the connection of myofunctional symptoms leading to sleep disorder breathing and sleep apnea, snoring, TMJ problems and clenching, grinding, pain, because to me now it's so much easier to have a conversation with a parent about why would you correct these things rather than me having to say, oh, well, the tongue thrust is a problem, which nobody really gets or connects to, or, well, it'll affect the way your child's face grows, so they might not be attractive as adults. I just like,
they need implants or I'm not sure. Yeah.
I feel like those were the conversations that I had to have in the early days. And I of course didn't quite say it like that. I'm being funny, but I'm very happy that now we are able to connect the dots and help patients with their breathing and sleep and pain by addressing these underlying issues. So, I mean, those are the things that I see in my patients and in our practice. And I'm very happy to, have that conversation shift about like our bigger picture health and these, somewhat kind of small seeming like, does it really matter if you breathe through your mouth or your nose? Actually, yes, it does, because mouth breathing can lead to sleep apnea. Like being able to have that conversation makes me feel so much better as a provider these days. So Melissa, you can go into like the ortho side and all that, because
I'm actually going to go into I mean, yeah, of course, for ortho benefits, for ortho stability and dentition, absolutely. I mean, it's amazing what that can offer for the stability of the bite and keep the stability of the craniofacial support, the growth, as well as the airway and all of that structural stuff. But I guess I'm going to open a little can of worms, but I'll leave it, and maybe it will open the door. We'll have another conversation another time. For me, what tongue posture represents and does is it supports mental health. I'm a very big advocate, and I talk a lot about my own struggles with anxiety and depression, and the ability to have proper tongue posture and have support on the palate and truly breathe through your nose and quench your central nervous system is such a human right? I love when people talk about it's your right. I'm like, well, there might be some of the things I don't agree are your right, but everybody deserves the right to be able to quench their own central nervous system, to be able to take a breath of air, to calm themselves, to feel loved and supported within their own body. My biggest part now, and one of my biggest areas in advocacy, is you can't get good mental health if you don't have proper oral rest position. You can't get your head right if you don't know how to breathe right. And it's really crucial for self-worth, self-love, for all of those things that are so much, that actually are the biggest things in the world, right? Being able to love yourself and breathe and be able to ebb and flow through all the twists and turns that life has to offer, because this journey is hard, but it's beautiful. And this vessel, this monkey suit, this meat suit that we wear is here to protect us. And it has so many tools, and so many people struggle to use their own meat suit and to feel comfortable in it. And I am somebody that struggled for 40 plus years feeling comfortable in my own skin. And my journey with myofunctional therapy and my ability to create my own tongue posture allowed me to start doing the work on getting my mental health straight and myself better, and allowed me to do and open for me to do breath work and find my shamans and my woo-woo people and all of these people that make me feel like me, is really important. And for me, that's the biggest gift that this tongue posture gives us.
Thank you so much for that perspective, because I would never, and I have never thought of that in that way. And I do feel like I keep bringing up the pandemic, and I don't mean to, but people's anxiety is so extreme. And especially that teenage population who hid behind a mask for years.
You let me know, because I feel, one of my biggest missions, I would love nothing more, is there's a lot of ways we can help people overcome some of those anxieties and relieve some of those things, and almost give forgiveness for some of these things that happen, because no matter how you feel about the pandemic, I'm going to leave it. There was a crime in covering people's faces and forcing them not to be able to breathe. I'm not saying there wasn't reason to warrant, so I don't need the haters. I get it. I know the other side. I'm very aware of it. I respect everyone's opinion, but I ask the same as putting a mask on somebody who already struggles to get air is also criminal, right? And it caused a lot of stuff, and it caused a lot of anxieties. But on a positive of that, us as myofunctional therapists, us as airway advocates, us as these people that know we can really retrain and change that and show patients how to fix it. So whether they are anyone listening, whether they find you guys or they find us, there is an answer for that. And it's through the breath. And the only way you can get to the breath is by having proper tongue posture and knowing how to do that. So there's a beautiful answer. There is a cure.
Oh my God. Thank you so much for spending this time with us. I would definitely love to, or we would definitely love to do a supplemental to this in the future. I just think the information that you were able to share, and especially from a dental hygienist perspective, is so important for anyone that's listening. But we do play this in our waiting room so our patients and their families can hear the insight of all the professionals that we get to speak to. And I think they are going to thoroughly enjoy just everything you've had to say and opening and shedding some light and different perspectives on myofunctional therapy and breathing and emotional support and emotional health. It was just really, truly a pleasure having both of you.
Thank you for joining us on this episode of Talk the Talk.
We hope it was enjoyable and educational and further supports you both personally and professionally.
For more information, please check out our Wyo Myo and Myo Minute podcast, as well as our other episodes of Talk the Talk.
And stay tuned for more information about our newest venture, the Spot Pal, a tongue training appliance.